Now, for those of you who are Facebook friends with physicians, certainly I am and follow them on social media, you've seen a lot of posts regarding American Academy of Pediatrics or American College of Obstetrics and Gynecology, or just responses by physicians. So, major medical organizations like AAP or ACOG have responded to the recent FDA announcements with opposition to the label change. They have rationale behind behind their positions that's based on studies that perform sibling control analyses. So there was a published study in JAMA 2024, which was a nationwide Swedish cohort study of 2,480,797 children, where they used prospectively recorded antenatal and prescription records to assess prenatal acetaminophen exposure and subsequent diagnoses of autism, ADHD, and intellectual disability. The initial population-based models, when adjusted for wide ranges of confounders, including maternal sociodemographics, psychiatric history, and other analgesics or pain medications, showed small but statistically significant associations between acetaminophen use and all three neurodevelopmental outcomes: autism, ADHD, and intellectual disability. However, when sibling control analysis was applied, comparing outcomes in siblings discordant for exposure to account for shared familial and genetic confounding, no association was observed for autism or intellectual disability. The authors concluded that the observed associations in conventional models were likely attributable to unmeasured familial confounding rather than a causal effect in acetaminophen. So both of these studies used sibling control analyses to rigorously address confounding, and both found no association between prenatal acetaminophen exposure and neurodevelopmental disorders when familial confounding was accounted for.